Complications for more than 200,000 women in the United States each year. But experts say some of the advice about the condition on social media is either confusing or it's wrong. Here to explain is Dr. Tom McElrath, a specialist in high-risk pregnancies at Brigham and Women's Hospital. Doctor, thank you so much for joining us this morning.
Good morning.
So the first question here, what puts a woman at risk for preeclampsia? Is there a way for her to know during her pregnancy?
So that's a great question. There are high-risk characteristics. So patients at high risk of preeclampsia, if they have pre-existing health conditions such as high blood pressure, diabetes prior to pregnancy, pre-existing kidney disease, lupus or autoimmune conditions. These are what we consider to be the high-risk category for preeclampsia. And unfortunately, patients in this category will have a 1 in 4 chance of preeclampsia. And in medicine, 1 in 4 is a high risk. Additionally, first pregnancies are also at increased risk of preeclampsia.
Well, we mentioned a moment ago, too, some bad information online about this condition. Can women find at least some good advice online, in your opinion?
Yeah, absolutely. I mean, searching for health advice online is just like searching for anything online. You really need to be a wary consumer and mix in while you're doing your social media posts, your searches, you're looking at Reels, TikToks, or websites, mix in information from accredited or branded institutions. So a hospital that you recognized, Brigham and Women's, for example, the Mayo Clinic, for example, or professional societies, the American College of OBGYN, the Society of Midwifery. These are all sources that are accredited, and you should at least include that in your searches and as you're looking for information, because many of these actually are the conditions for which we as providers are being held or you of and treating you for.
Preeclampsia, of course, such a serious condition. What are some of the most dangerous myths that you've heard?
That's a great question. I think the biggest myth, and I get this from my patients, is that if you've had preeclampsia, it's not your fault. Preeclampsia happens. It's not something that you did or could have done otherwise. But I think one of the biggest other myths is that if I'm healthy, I'm not at risk of preeclampsia. I have patients who are marathon runners and have had preeclampsia. There are professional athletes and there are Olympic athletes, all of whom have had serious preeclampsia. So it happens even to the healthiest of folks who are out there, unfortunately.
You alluded to this a moment ago, but where can women go to get accurate information?
So I think your first stop is your care provider, your midwife, your OBGYN, your primary care doctor. They know your individual characteristics, so they're going to be your best first stop for information. But in addition to that, there are some very good patient advocacy groups that are online. I like endpreeclampsia.org. They are a group of moms, all of whom have had preeclampsia and have been trained and volunteer their time to counsel patients through prior to preeclampsia, during the diagnosis, after they've been diagnosed, prior to pregnancy, during hospitalization. So they do a really effective job of being a third-party advocate and source of quality and supportive information.
Dr. Tom McElrath, a specialist in high-risk pregnancies at Brigham and Women's Hospital, thank you so much for making time for us this morning.
My pleasure.